Bridge, new frontiers in type 1 diabetes.
The first step is to educate people on symptoms of type 1 diabetes and DK. If nothing else, say you now have this early stage disease, you need to know what to watch for, and that is critical because many people may not return for regular follow-up or may potentially, especially with young kids, progress in between visits. And then if you have a single autoantibody that's positive, you can see here that on the recommendations on the left for children and on the right for adults, because it's only a single autoantibody, we want to know if people are progressors or regressors. So we recommend measuring antibodies every 6 months for kids less than 3, then annually for 3 years and then stop, and at least annually in older children for 3 years and then stop. There is a recommendation to do some metabolic monitoring along with this in children, so do an A1C and a random blood sugar for the first 2 years. In adults, the recommendations vary a little bit, or are different than the pediatric ones. So you consider an annual A1C if there are additional risk factors, including a first-degree relative, dysglycemia, or history of stress hyperglycemia. Otherwise, perform repeat antibody screening every 3 years. Once you have 2 or more autoantibodies, again, you're in stage 1 of diabetes, no longer at risk. Again, education is critical. Here you can see the monitoring frequency for people with stage 1. Again, in children, it's more frequent, every 3 months for kids less than 3, 6 months for 3 to 9, and 12 months for kids greater than 9. Use an OGTT to stage diabetes when available. And for adults, because the progression is slower and because they often get A1Cs as part of primary care every year, the recommendation is to do an A1C every 12 months and then modify that frequency depending on age, number of antibodies, and type of antibodies. And if an A1C changes more than 10%, to perform an OGTT. In stage 2 frequency, children, it's recommended to be monitored every 3 months, adults every 6 months.
Bridge, new frontiers in type 1 diabetes.